especially for the Portuguese viewers. I am now working since March in the recent Portuguese agency, which is AICIB, the Agency for Clinical Research and Biomedical Innovation. We incorporated all the front that I'm involved in relating to the European framework program, apart from doing, of course, other relevant things. So we are kind of the new kid on the block in health research and innovation in Portugal. My perspective today is a bit to share with you, and I have a few slides that I want to show you, and then we are even available to share the slides in the audience if possible. You can contact me for further information. Health data is key for European health research and innovation and for European health systems. We have a long track record of regulation in this field, but one of the most important hallmarks was in April 2018, when the European Commission released a set of information which was called the data package. And this data package included a specific communication on digital transformation and health and care in the digital single market priorities. So a communication specifically focusing on the importance of digital health and care. And in this communication, this is like the really short summary. The European Commission identifies the health challenges that we face and refers to digital applications and data as a major strategic goal to solve these challenges. And the Commission defines three priorities. The first one, it's citizens secure access to their health data, also cross borders. So this means that we should be able to access our health data when we travel across the EU. So if I go to Brussels, which I don't do anymore, now COVID has changed a bit our lives, but I should be able to go to a hospital, to a pharmacy, and have access to my data. The second priority is that we can use personalized medicine. We can practice personalized medicine, do research on personalized medicine by having data pooled for research. This means that we need to invest and to perform specific actions on this front and to develop initiatives on this front. And the third priority is the citizen empowerment with digital tools so that we can give feedback and we can really provide a person-centered care. What does the Commission want with these three priorities? This means that the Commission has to take actions and countries have to work in order to reach these priorities. And for each of them, many things are happening at European level. So this has been like the framing legislation since 2018, and we have been working on this since then. More recently, now in February 2020, the European Commission published an European data strategy, which goes a bit along the same lines and reinforces what the previous communication stated. So we are all aware in Europe that we need data-driven healthcare and innovation, and that all the tools that we have available so far can strongly contribute to better health of the citizens, right? In prevention and risk detection, therapies, diagnostics, and eventually in new health and care models. What do I have to show you today? What I have to show you is that the European Union sets this as priorities and then invests in projects that put together stakeholders from different countries so that we try to reach these goals. And this is what the European Research and Innovation Program does when it concerns to the health area. So here in the slide, you have a few examples, not related to COVID yet, but just a selection. These are recent projects, 6 of them are shown here. Actually, Portugal participates in 4 of them, of projects that are related to health and that all want to contribute to the improvement of health of citizens, or some are specifically focused on the aging population, others in neurological diseases, others like Smart for Health, which Portugal coordinates, are specifically working on the exchange of electronic health records. A lot of money is being invested. all these projects need that at least 3 European countries are working with the same goal. So this research and innovation that the European Commission is funding, it's multidisciplinary, it's cross-sectoral, and it's transnational in order that we reach the goals that we have established. More recently, when the COVID-19 outbreak came up in early this year, the Commission had a particular step towards data and COVID data, as Pedro just presented. Very early, still in March, I think, the European Commission presented a plan, an Era versus Corona Action Plan, European Research Area versus Corona Action Plan. And this plan included 10 measures that Europe would put in place in order to face the pandemic. Several measures, some of them included the opening of calls for new research, new innovation actions in order to reply to the pandemic. But one of these actions was the creation of this portal that Pedro just presented, the COVID-19 data portal. So this is molecular. I thought we also had some patient data here. Maybe we can discuss that later. After what Pedro's presentation now, I was not sure actually what kind of data it's being gathered exactly now. And the European Commission also opened calls for projects directed to COVID in all areas, not only health data, which is mostly the focus of our discussion here, but here you can have some examples of how, in this case, projects that were already ongoing redirected their activities to tackle COVID-19. So the European Union, until September 2020, invested almost 500 million from Horizon 2020, the Research and Innovation Program, to fund projects that were ongoing and redirected their activities. And also, of course, new projects were funded. You have here some examples of the project Eden, Conception. They are all online, Vaccines for EU. They are helping the European medicines agents to gather real-world data on COVID treatment and vaccines, and also Radar CNS that uses wearable technology and mobile devices to assess the impact of COVID-19 lockdowns. Again, I don't know the details of all these projects, but these are all available and currently contributing to the European response to the pandemic. And also new projects started during 2020, specifically targeting this response. I have here like a small selection of projects that are more related to health data and how this can help solving or giving the European and global response to the current pandemic. Anyway, COVID will go away we don't know when, but it will go away. I think we can learn a lot from what is happening, looking at the positive side. But from my side, what I want to tell you too, it's that the European Union will continue funding and there will be many funding opportunities in relation to health data, not specifically COVID, but in general. Although this is an European program, and mandatorily we need to have projects including 3 member states or countries associated to the program. This is a program that is open to the world. So the participation of other countries, or third countries, it's very welcome. So I would like to give you here, this slide is confidential, or this is all subject to change. These are possible topics that will open, possible calls that can open within the next couple of years, that will provide opportunities for the research and innovation community to apply to solve these challenges that the Commission is posing. So you can see data-driven decision support tools for better health and care delivery and policy making, new methods for real-world data, innovative tools for the use and reuse of health data, scaling up multi-party computation, so on and so forth. I can give further information on this for people who want. So my take-home message, and you have my email in the last slide, and from what I think I can give to this roundtable, it's that a lot is being invested. It's not only the money, it's the fact that we work together and we learn from the experience of each other. And this is the thing that we have then to upscale and to do. The difficult part is always to promote the real uptake of these solutions into the healthcare system, so that they really translate in the improvement of health to the citizens. Thank you.
Thank you so much, Patricia. I love the last slide where you finished the presentation, because it's really the picture of harmony in humanity that we all seek after this pandemic. Get back to our better self as a species.